Hello, everyone. Welcome to our COE workshop series for strengthening capacity to manage child and adolescent TB. And these workshop series have been organized by the Union's Sub-Saharan Africa Child and Adolescent TB Center of Excellence. And this is a collaborative platform with a division of global HIV and TB of the Centers for Disease Control and Prevention, CDC. My name is John Paul Dongo, and I'll be co-moderating this session with my colleague Britton Moore from CDC Global TB branch. And very shortly, we'll have a round of introductions where we'll get to meet each other and get to know each other. Next slide, please. On our agenda today, for the next 1.5 hours, we'll have opening remarks from Jennifer Harris from our CDC Global TB branch. I'll then come in and introduce participants to the COE workshop series. Thereafter, Rita Dlodlo will come in and make a presentation reviewing the workshop sessions, schedule, COE learning and COE learning resource page. And just at the very end of Rita's presentation, we'll also have a colleague, Rita Monday, who will practically show our participants how to log on to the COE pages where the resource documents for these sessions are being stored and can be accessed by our country participants. Britton Moore will then lead us through a discussion and a feedback session, and the discussion on what country teams expect to get out of this workshop series. And thereafter, Amalia King will review the resource documents and PowerPoint presentation templates that country teams will be using to do their post-session work that we'll get to know as we go through this workshop series. And really, these resources that Amalia will be going through are resources we'll use to assess national strategic plans and guidelines, assess capacity building strategies at country level, but also be able to assess training materials and content within our respective countries, also do a needs assessment, conduct a mapping exercise for existing partners and resources. And finally, Amalia will also take us through reviewing the PowerPoint template that country participants will then use to develop short presentations after conducting all these assessments at country level, summarizing the findings that will then be able to listen to you in session 2. And then Britton Moore will finally come up and close our session. Next slide, please.
Thank you so much, John Paul. My name is Brittany Moore, as John Paul mentioned, and I know many of you, the representatives from the 3 countries that are part of the COE. I'm an epidemiologist with the Global TB branch at Division of Global HIV and TB at CDC, and I'm the CDC co-lead for COE. Over to you, Amalia.
Hi, good afternoon, good evening, everyone. My name is Amalia King. I'm a public health advisor in the Global TB branch in the Division of Global HIV and TB. Very happy to be here, to be meeting with all of you, and I hope you have a wonderful session. We're looking forward to talking with everyone.
Thank you, Amalia and Britton. Next slide, please. And my name is John Paul Dongo. I am the country director for the Union Uganda country office, but also the union's lead on the COE. Over to you, Rita Monday.
Thank you very much, Paul. My name is Rita Mandi. I'm the Monitoring and Evaluation Officer working with the Union Uganda office. Over to you, Rita.
Thank you very much. Good afternoon. Good morning, everyone. My name is Rita Lolo. I'm a senior advisor with the Union, and I'm joining this webinar series, session 1 from Bulawayo, Zimbabwe. Over to you, Selma.
So Rita, Selma is not able to join us today, but Selma is the project officer for the cooperative agreement with CDC. Next slide, please. And next slide, please. Thanks.
Thanks so much, John Paul, and it is really a pleasure to be here. As the slide says, my name is Jennifer Harris, though I frequently go by Jenny. Feel free to call me that. I am an epidemiologist and team lead for a team at CDC called the Special Activities and Initiatives Team, which is not very descriptive, but I can say that pediatric TB falls within that team. So this is the COE is one of our activities, and I'm very happy to be here to support it today. So acknowledging the contributions from members of the COE during our first 2 years together, especially given the challenges of competing priorities presented by the COVID-19 pandemic. Your commitment and active participation have ensured that the COE continues to be as successful and responsive to the needs of your programs. We look forward to the spirit of commitment and collaboration throughout the workshop series that we are launching today. With the recent release of new WHO guidelines for child and adolescent TB, this workshop series comes at a time of renewed focus and energy from the global TB community. As you know, there is still much to be done to close the gap between policy and practice in child and adolescent TB. The case detection gap, especially amongst the youngest children, remains large and has grown because of service disruptions due to COVID-19. This gap continues to be contributes to the disproportionate burden of death among children, especially young children. But there are also new approaches for case detection, including the use of child-friendly specimens, integration of chest radiography, and use of clinical scoring algorithms that may help us overcome some of these barriers, but only if implemented at scale. There are also more patient and family-centered models of care that reduce the burden on both the patient and the health facility. These models had been discussed pre-pandemic, but have been seen as more feasible and viable after early experience with these models during COVID. We hope that this workshop series provides a structure for thinking strategically about how each country's Ministry of Health and partners can build capacity to manage child and adolescent TB at the lowest levels of the health system. We take an expansive view of what capacity building means. Training is and always will be an important component, but we also want to think beyond didactic trainings to skills-based hands-on experience, as well as the importance of mentorship and supportive supervision in accelerating and maintaining skill retention. Incorporating the best strategies for skills transfer and changes in practice can facilitate the rapid and efficient scale-up of best practices. This is the first session in the workshop series, which will consist of 5 sessions total. Active participation throughout all 5 sessions will be critical to develop a strategy that is responsive to each country's needs, as well to facilitate sharing of challenges, insights, and solutions across the 3 countries. CDC and the Union are committed to supporting each country to succeed in this endeavor and will provide assistance as each team works through the sessions and the post-session independent work. We are also committed to working with each country by opportunities and resources to put this strategy into action upon completion of the workshop series. So without further ado, I would like to launch this first session of the workshop series on behalf of my CDC and Union colleagues and wish all of you an informative first session today and a productive online experience throughout the workshop series. Thank you.
Thank you so much, Jenny, for those very wonderful opening remarks. I think my presentation really is going to give a brief introduction to the workshop series for strengthening capacity to manage child and adolescent TB. Next slide, please. So why capacity building and not training? So I'll really just go through the definitions of these 2 terms and why the COE has decided to refer to its workshop series as a capacity building approach and not training. So when you talk about training, this is really teaching to make people proficient by instructions and practice in some sort of art, profession or work. And the training improves one's capability and capacity to be productive and exhibit performance, but does not address the desired outcome. Whereas capacity building is defined as the process of developing and strengthening the skills instincts, abilities, processes, and resources that organizations and communities need to survive, adapt, and thrive in a fast-changing world or environment. There are usually many methods and strategies needed to build capacity, and training is just one of them that is used in building capacity. Next slide, please. So when you look at health systems and workforce capacity building, health systems have very many different aspects of futures, and these are always complex in nature. And when you look at the WHO building blocks framework, these identify a knowledgeable, skilled, and motivated health workforce as a key pillar of robust health systems in any setting. So many things keep changing around, and particularly us in the TB world. The epidemiology of TB, policies and guidelines, technology are always changing. So we therefore need strategies that staff at all levels of the health system can maintain adequate skills, knowledge, are motivated to achieve TB program objectives for now, but also in the future. And this slide, next slide, please. These strategies should be focused and responsive to build and sustain workforce capacity. They should be dynamic, evolving over time, but also with the changing needs of where we're coming from, different countries and communities where we're coming from. And they should also be unique to each country. We all know that all our different countries that we come from have different TB epidemiology, but also the health systems are different. We also know that from our respective countries, we have different training opportunities and clinical rotations that we do in our respective countries. And also the roles and responsibilities of healthcare workers tend to vary by cadre and also by country where we come from. Next slide. So the goal of the COE workshop series for strengthening capacity to manage child and adolescent TB, the Union and CDC envision that at the end of this workshop series, country teams are able to put together a national capacity building strategy for child and adolescent TB that can be tailored to the country context, including health system and populations. That should also be flexible. It should be relevant and responsive to the current challenges and should easily be adaptable to the future, but also to unknown challenges. It should be measurable. How will you know that you're meeting your objectives in your country? We should also be able to have a strategic plan that includes a framework by which the country will know if they're on track or they need to change or adapt to a different approach. And finally, this capacity building strategy countries should be able to acquire resources, but also be able to plan and obtain resources that should be used to implement the strategy. Please, next slide. So our ultimate goal is at the end of the day, once we've gone through these 5 sessions of the workshop series, we should be able to have our countries adopting this and being able to implement a national capacity building strategy for child and adolescent TB. Next slide, please. We have a total of 5 slides. We've already been told by our previous speakers that the workshop series has a total of 5 slides. I'll not go in detail of these slides as the next presenter, Rita Lodlo, will go over these in detail and will be able to understand what is comprised of each of the slides. Next slide, please. So as I wind up my very brief presentation, we call upon all country participants to be with us through all the 5 sessions and also be able to complete assignments that we'll be getting in between sessions. And we encourage that we all actively participate with and attend all the 5 sessions. And at the end of the day, we should be able to provide a certificate of completion to participants that go over all the 5 sessions, but also we'll also be able to provide free registration, apologies for the typo, to the union's 2023 World Conference on Lung Health. We'll also be able to provide complimentary union membership with access to the International Journal of Tuberculosis and Lung Disease, but also the Public Health Action Journal, and also will feature the participants in the union's news item that is disseminated to all membership mailing lists. So we would like countries to be committed to ensuring that the strategy and training programs that will get and develop through this workshop series are implemented and cascaded to appropriate subnational levels of the healthcare and TB services. And as Jennifer also pointed to this, the COA will work with teams that develop and finalize a capacity building strategy to identify strategic funding opportunities for implementing their vision. I thank you all for listening, and let me now invite my colleague Rita to take us through the next presentation. Over to you, Rita.
Thank you very much, John Paul. And let me pause here just in case there are any questions or points of clarifications to what Jenny and John Paul have so far gone through. Please unmute yourself or put your question to the chat. Thank you. I don't see any responses so far, so we will proceed. Colleagues, don't hesitate to seek clarifications as we go. Rita, let's go to the next slide. I have got indeed 5 or 6 slides going through the 5 planned workshop series sessions. And today we are here in session 1, which is really our introduction session. All session introductions or details follow the same template. In the left-hand side column, you will see the objectives, and in the right-hand side column, we sum up some post-session work that we wish the country teams to take care of in preparation for the subsequent session. We also have a plan, we have sketched certain deliverables. So over here in this today's session, I think we are now in objective number 2, and we are approaching introduction of the resource file folders on the union's webpage, particularly devoted for the Center of Excellence activities. We will also go through the methods and resources that will assist all of us and all of you to go through your national guidelines, training, strategies, training and capacity building materials. We also wish to share with you resources that can facilitate assessment of staff training needs in the field that we are focusing, that is child and adolescent TB. And we do not wish to cover only national level. We would really like to consider the fact that services are provided all throughout the levels of health systems. So I really welcome participation from my home country, Zimbabwe, which seems to include a district TB coordinator. That's fantastic. And lastly, we will map the existing partners in your countries that provide technical, financial, or any other support to you. Perhaps we'll go back to slide 1, please, or previous slide, for us just to have a quick glance through about the post-session work to be completed by the country teams. So indeed, after going through the resources and proposed methodologies for the assessment, we would like you to actually have the critical view of your guidelines, etc., etc., and do a little bit of a SWOT analysis. Where are the strengths? Where there may be some gaps, weaknesses, or challenges? Identify opportunities and identify also threats. As a deliverable, we envisage a country team presentation of some 15 minutes in session 2. And thank you, Rita, for already projecting the next slide, slide 19 here. So this is South-to-South experience sharing. We do not claim to have all the knowledge. We have probably less knowledge and less competencies, less understanding what works in your session, in your setting than yourselves. And we would like to hear, as well as ensure that the 3 country teams cross-fertilize experiences, what has worked in Uganda may be of value in Zambia, etc. Post-session work to be completed pertains to this SWOT analysis that I have already referred to. Let's then go to the next slide, slide 20. It sums up session 3, where we would like to review adult learning theory, also known as anthropogy, and which we adults learn. We will also go through an ADDI model. It stands for Assess, Design, Develop, Implement, and Evaluate, that we can use we can apply as an instructional guide for assessment of our capacity building strategies in child and adolescent TB. And again, the right-hand side column sums up the work to be completed by yourselves. We would like you to conduct a root cause analysis, perhaps using 5 whys method or the fishbone method, to determine root causes for 1 or 2 key challenges at different levels of health services for successful implementation of these services. I think Jenny has recognized the to persist in all our countries in spite of all our attempts to narrow it. And this root cause analysis is hopefully going to identify causes within our powers, within our control, to change, strengthen, improve, so that we could make progress regarding particularly capacity building strategies. There's some guidance on design. I'll skip it in the interest of time. Let's go to the next slide, please, Rita. Session 4 will then indeed continue on the lines of South-to-South sharing. We will listen to each other and learn from each other in order to implement public health capacity building strategies based on the previous session. And the deliverable is now then aiming us to take the workshop series towards its end and towards a presentation summarizing the proposed components that would make up your national capacity building strategy for child and adolescent TB. Let's go to the second last slide.
Wisdom. Hello, Rita. Are you there?
I'm back here.
Okay,
So
sure.
there seems to be some background noise. It looks like the alarm system of my house has gone on, but a family member seems to have been able to sort it out. Sorry for the interruption. So I wish that I'm still audible. Okay, and the final session of our workshop series will then indeed culminate in sharing of the strategies that the country teams in Uganda, Zambia, and Zimbabwe have proposed as they move forward in particularly implementing the revised international normative guidance that WHO launched at the World TB Day earlier this year. Let's have a look at the proposed calendar, which I think is on the next slide. So indeed, the calendar has one set date, that is today's date. The 4 remaining sessions, all proposed to be of the duration of 90 minutes, are still to be convened, and the dates are always rather busy people, and you have many things to attend to. So John Paul or Rita Mande are the persons that you will be hearing from when we set the calendar for the remaining sessions. I think slide 24 will actually take you through the COE page resources, and I'll hand over to you, Rita M. Thank you, colleagues.
Thank you very much, Rita. I'll just take us through to and how to access the resources that will be shared. So in the slides, which will also be shared with us, we have a link on which we shall click on to log on to the Union General page. Give me a minute as I try to share the screen. So login details will be shared with us, and this is how the page looks like. So when we come to this, we're able to access quite a number of things, but our focus will be on the tuberculosis right here where my cursor is, where we can access quite a number of things, quite a number of resources and publications. So when we get back to our slides, you realize that the 2 links that were shared. So this second link is what will give us access to the resources that are going to be shared, including today's slides. And just a minute as I share my screen on how it will look like. Okay, I'm hopeful that we can all see this. So this is where we shall have resources on the COE webinars, and this is how they are detailed. Like previous speakers have said, we'll have about 5 sessions, and all the material that will be shared will be accessed on this website. I think that's it. Over to you, John Paul.
Thank you so much, Mandy. Just again to speak to Mandy, those 2 links really, one is a general COE page where we post all the regular webinars that we've held from the time the COE started working, but also we post their general reading materials and content from different sources, from guidance from global institutes and all that. And then the page that has the sessions, this really has the resource documents that you will be using for the different sessions from session 1 to session 5, but also on this site. You'll also be able to have the recording of the different sessions that we'll be holding from now until the end. So we'll be sharing country-specific login details, where each country has its own password to be able to access. But I also want to say that the general COE page is really very open to anyone out there. You can go in and be able to view any things that relate to the COE activities. And then the other one really has very specific content for this workshop series. So that's why you'll be able to find all the respective resources. So maybe Rita, if we can go back to our slides. Our next presenter is Amalia. Amalia, do you want to run the slides from your end?
I don't have them up, so if Rita could do that, that would be great.
Okay, Rita, please run the slides again for us so Amalia could go through with her presentation. Thank you. Over to Amalia.
Great, thank you so much. Hi, everyone. My name is Amalia King. It's wonderful to be here on the call today and to be a part of the great discussion with the teams. And I am really, really looking forward to the remainder of the workshop series. This is the launch of Cohort 2, and we're about midway through Cohort 1. And I think we're starting to get some important and really, really great traction with momentum. So I'm excited for the teams on this call for what's down the path and in the pipeline. So as part of session 1, we do want to provide the team some resources, as well as a template for the teams to take back. After you're completing this session 1, you come together as a team in your countries and you start to really, really critically think about what is the current context, what is the current landscape within my country as it relates to child and adolescent TB, not just looking at the epidemiology, but looking at a plethora of different factors. So there are a few different resources that we are going to quickly review. One is called the Assessing National Strategic Plans and Guidelines. The second one will be a resource to assess any capacity building strategies that are ongoing within your country. The third resource is to support country teams to assess any training materials or content that may already exist within your countries. The fourth resource is a tool that hopefully will support the country teams to assess the different gaps as they relate to knowledge, skills, and attitudes for staff at all levels of the health system, from the lowest level to the national level. We have a resource to support country teams to map existing partnerships, resources, and remember, resources can be human, they can be financial, they can be any different types of resource. So we really want the country teams to keep an open mind on that. And lastly, we have a template that we would like to share with each of the country teams, which will be used by you all to synthesize and summarize your findings from the different assessments and activities that you have completed post session 1, and you'll be able to report that back in session number 2 and share with the COE, Union, and CDC team, as well as other countries. And hopefully this will be an opportunity to hear from other countries what their gaps are, what their challenges are. And we might be able to see some common themes that start to emerge across the different countries, or we might start to understand if a challenge in one country has been successfully overcome, that another country can start to dive into and see, how did they do that? How can I do that in my country? So I do also want to preface this discussion by saying that none of these resources are required to be used by any of the country teams, but we developed these resources in the hope that they would be helpful in facilitating, jump-starting, guiding your discussions, not only within your own national TB program, but we really are hoping that the country teams will be able to look beyond just the national TB program, because we know child and adolescent health transcends TB. We have MNCH, we have ANC, we have adolescent health. There are a lot of different programs within countries that touch on child and adolescent health, and TB is obviously a very critical and important part of health for children and adolescents. But, you know, it might also be something, there might also be opportunities to engage with other programs. So with that being said, I will go ahead and start sharing my screen. So Rita, can you stop sharing, and then I'll go through the different resources. Thank you so much. All right, great. So the first resource I want to quickly share with the different country teams is the resource to assess national strategic plans and national guidelines. And the format of the first two resources are fairly similar. We have identified several different thematic areas: child and adolescent TB epidemiology, performance monitoring, data management and forecasting, prevention, topics around drug-resistant TB, as well as TB diagnosis, TB treatment, social factors, and co-infection between TB and HIV. And so in each of these different thematic areas, we have really tried to think about what are the most important, critical pieces of information and content that we from the COE CDC union team perspective feel should be included as part of countries' national strategic plans or national child TB guidelines, or even other documents. And I mean, really think expansively. You can look at laboratory strategic plans, you can look at other strategic plans where you feel there might be some sort of connection with child or adolescent TB. So use this resource if it's helpful to you, to help guide you through reviewing some of these national level documents. And if you have any questions, please don't hesitate to reach out to us. And then I will go ahead and I will share the second resource. So the second resource is really to support countries to think about what are the current capacity building activities or strategies that are already ongoing within my country that might touch on child or adolescent TB. So even if you probably already have some sort of efforts that are ongoing within the national TB program, but as I mentioned, child and adolescent health is not just a TB related program issue, but it transcends to other programs like nutrition, HIV, adolescent health, ANC, MNCH, EPI, laboratory. So we really encourage the country teams to make a really purposeful effort to liaise with staff and POCs from other departments within the ministry or other stakeholders to think about what are the current existing capacity building activities that are happening within my country that may touch on topics of child and adolescent TB. So we want, we think it would be helpful for country teams to look at what are the existing classroom training activities. Are there any mentorship activities that touch on child and adolescent TB? Are there any on-job training activities? Is child TB or adolescent TB included as part of normal supportive supervision visits? Are there any job aids? And also, starting to think about, if child and adolescent TB is touched on during performance review meetings, for example. So this is just a very, a brief summary of ideas. There might be other initiatives that you identify that you would consider capacity building. And if so, that's great. So make sure to really try to hone in and cast the net wide to think about where different programs are touching on child and adolescent TB, because it can help you think about if there are other resources, human, financial resources that you can leverage as you continue to move forward and start to develop a national capacity building strategy for child and adolescent TB. So let me go ahead and I'll share the third resource. So the third resource is really aiming to support the country teams to review any training content or curriculum that already exists within the country and look at it from that perspective of child and adolescent TB to say, okay, do we have, well, what content do we have included in the training, and where can we identify any potential gaps? Or is there any training content that was up to date, but now needs to be updated because of the recently released WHO guidance? So again, we've maintained the same thematic areas, which we hope are helpful for the different country teams to take and review your training content or curriculum or other documentation that the country historically or currently uses for capacity building within your countries. The fourth resource is actually one of my favorite resources. And this is a resource to support the country teams to identify knowledge and skill gaps as they relate to child and adolescent TB at the different levels of your health system. So we know that the gaps in TB diagnosis or TBT or TB treatment, those gaps might be different at the national level as compared to the provincial level or the district level or the health facility level. And one of the things as part of this workshop series, we would like country teams to really identify is what are those specific gaps and what are those specific needs at the different levels of the health system, because we know that we are going to be seeing some differences. And so the COE team developed a question bank for country teams to either use in their totality, which is fine, or you can pick and choose different questions that you feel would be most useful to your country context to try to understand where the knowledge and skills gap are as they relate to the different thematic areas. So epidemiology, performance monitoring, diagnosis, treatment. So you see here, we have, this is an Excel sheet. We have different tabs on the bottom. We're going to be updating this document a little bit more before we share it out, but we have a national level tab. So this includes knowledge and skills questions that we feel might be helpful to the teams within each of these different categories, each of these different thematic areas. And then you see here, we have another tab for district level, and we have another tab here for health facility level. While we are hopeful that the country teams will be able to move out and visit some sites at the subnational levels, we also recognize that it may not be possible from a time perspective or a resource perspective, and that some countries might only be able to do a national level desk review. That being said, we highly encourage the teams, and I think we've already started to see this because we look at the composition of the teams in some of our countries and we see some engagement from the subnational level, which is wonderful. But we really do encourage the national level teams to do site visits and go out to the districts, go to the health facilities and talk with the nurses, talk with the district staff, and try to get an understanding of where those skills and knowledge gaps may be, because that will help you design and develop your capacity building strategy for your target audience. So you have to know what skills and knowledge they have and where their gaps are in order to know what type of content you want to target for specific target audiences. So I think this is a really great resource. Again, it's not a requirement to use any of these resources, and we really just want to present them to the country teams. And it will be fully up to your own discretion on if you want to use these resources at all, if you would like to use them in their totality, or if you would like to kind of pick and choose different pieces that you feel are most applicable for the context in your country. So the final resource that I want to share with the country teams is a resource to support the countries to do a mapping exercise as it relates to financial, but also stakeholder engagement for different child and adolescent TB activities. So really the aim of this resource is to support the country teams to look broad strokes within their country and say, who is doing what with child and adolescent TB? Where is this happening? What topics is it targeting? Is it looking at DRTB? Is it looking at contact investigations? Is it operational research? Is it radiology? Is it TB treatment? So we tried to create a simple template whereby countries could categorize and identify like the top target areas for child and adolescent TB as they relate to each of the specific activities and stakeholder engagements. And you'll see in the second tab down below, we actually have a very simple visualization dashboard, which we hope will support the countries to see, okay, where are the different activities being conducted? Are they being conducted at the provincial level? Are they targeting the district level or the health facility level? Are most of my activities focused on recording and reporting or community care or drug-resistant TB? So hopefully this will start to show you the picture comprehensively of what is actually happening in your countries as it relates to child and adolescent TB. And again, this is not a one-size-fits-all resource, so we know that it might need to be adapted depending on your country context or your country need, and we fully support the country teams to move forward and do that. This is just a template for countries to be able to use to help guide them in their discussions and their planning as they start to think about the landscape in the context of child and adolescent TB in your countries. So let me go ahead and share the last. I wouldn't consider this a resource, but this is here we go. Oh, I don't know where it is. I'll go ahead and just share my screen right here. So this is the session 2 country team template. So this is a presentation template that we hope the country teams will be able to utilize as they report back their findings from the different post-session 1 work and assessment activities that you will be doing as a country team. So it has a slide focused on the assessment methods, assessing your national strategic plans and guidelines. And you'll see we have slides for all of the other resources. And we do hope that you will also give us some good constructive feedback on the resources that we are providing the teams for this post-session 1 work. We are always looking to improve. We have other cohorts that we will be starting over the summer and in the fall. So any feedback you can provide to us as the COE team to improve these resources would be incredibly appreciated, and we would be very grateful. So let me go ahead and stop there. And Rita, could you go ahead and share the presentation again? Great, thanks so much. Next slide. So we're getting towards the end of the presentation. I know we only have a few minutes left, but I want to use this analogy of climbing Mount Kilimanjaro to talk about why we're thinking about providing these resources to each of the country teams and supporting their effort to build this overall strategy for capacity building. So if we look at the map of Mount Kilimanjaro on the screen, we have a lot of different trails here that go towards the summit. We have the orange trail, the yellow trail, the purple trail, and all of these trails intersect at different points on the map. Some trails are starting in the north, others are starting in the west and the east, and other trails are starting in the south. So how do we know which trailhead to start at to climb Mount Kilimanjaro? And I really, in the most simplest terms, we really have to know where we are in order to know where we're going. As John Paul alluded to at the beginning of the presentation, the health systems in each of our countries are different. The epidemiology of child and adolescent TB is different. The context, the policies, and the challenges, as well as the successes, those are all going to be different within your countries. So that is why we have developed these resources for the country teams to use, to look at their national strategic plans, to review your guidelines, assess what is currently happening with capacity building in my country, what's already going on, looking at your training curriculum and your content, and trying to understand what are the knowledge and skills that staff at different levels already have and where the gaps are. So looking at this map, we know that the trail and the path, the journey to the summit, it's going to be different for each country because each country will be starting at a different trailhead. But as we move towards the summit, we should all be moving together, even though we're going to be on different paths. But countries may stop at different huts or campsites along the way. You may have to take a step back and say, okay, let me think about this from a different perspective. We've been doing this before. It hasn't been working. How can I reimagine? How can I reassess? How can I think about some routine work that it will continue to be ongoing, but how can I continue to improve it and reimagine what that looks like? So you may need to take a step back and kind of say, okay, let me look at this from a different perspective. But ultimately, at the end of the day, we all want to reach the top of Mount Kilimanjaro. So can you go ahead and click the slide, Rita? This is where we want to be. We're all going to get there. But what is success? Go ahead and click the slide. But what is success going to look like when we reach the top from each country's perspective? So Rita, you can just do like 5 clicks on this slide. So success is going to look a little bit different for each country. You might be standing at the summit and you might see the sun rising. You may stand at the summit and there might be a little bit of snow. There might be a lot of snow. You might be seeing a purple sunset. The picture at the top of the mountain, the top of Kilimanjaro, is going to be different because we're climbing the mountain in different weather. We're climbing the mountain in different times of year, and we're also taking different journeys. So while we know and we are super confident that each country team will be successful in reaching the summit and ultimately having a national capacity building strategy for child and adolescent TB, we know that success will look different in each country. And that's okay. We expect that to happen. We don't expect that success will be the same across the board. So we'll all reach the top, but the view is going to be a little bit different for all of us. So I want to leave everyone with that analogy. I guess we can move to closing remarks.
Absolutely. Thank you so much, Amalia, for walking us through those resources. And I see a comment in the chat, thanking you as well. Thank you, Dr. Amuye. So, I first want to start by echoing something that Jenny Harris mentioned at the beginning, which is, thank you all for your engagement and your contributions over the past few years. That level of engagement has been the very thing that made us believe that we could take on this more intensive effort to develop these capacity building strategies. And we know that what we've outlined, even just for the post-session 1 work, is a lot of work. We acknowledge that there are many competing priorities, but we do believe that this can help move our programs forward to push best practices and the latest evidence-based recommendations down to the lowest levels of the health system, or the part of the health system that is closest to the patients. And we also hope, as Amalia shared, that the strategy document developed as part of this work can also be seen as an advocacy document for additional needed to implement these important capacity building activities, especially considering that we're getting close to global fund proposal season. And we are continually trying to improve the series, the resources, the tools, and the outcomes of each session, what we're trying to work towards. So, if you have any recommendations or approaches that you think would be more helpful, again, please let us know at any moment during the series. And as the teams work on the assessments we've outlined, the COE team, all of us are available to answer any questions or provide assistance if you need. And also, as Amalia mentioned, and I believe Rita mentioned as well, these are suggested resources, and some of them were built out or requested from Cohort 1. So we already adapted and changed some of the resources to respond to their needs, and we would, of course, love to do the same for you. So please let us know if they are useful, or if they are focusing on efforts that you have already completed in country. There is no need to use resources that are not useful for your teams, but we hope that they are. So again, thank you all for your attention and engagement today during the first session, and we look forward to seeing you at the next session. Until then, take care and have a good rest of your afternoon and evening. Thank you all.
Thank you.
Thank you very much. Bye then.
Thank you. Bye.
Thank you.